Hey everybody, Dr. Tucker here from Active Family and Sports Chiropractic. So one of the big questions that I get on my acupuncture practice is how quickly does it work? Well, the shorter answer is it depends on what we are treating. So a lot of times people come in some sort of acute pain. They've got something bothering them. It's their knee, it's their shoulder, it's their elbow, it's their neck, it's their back, it's a headache, sinus pain and pressure. A lot of times, just one session, you are going to see relief. But sometimes cases are a little bit tricky. So sometimes it may take 2 or 3 sessions before you start to notice a difference, depending on how long you've had the pain or the injury or the problem going on. So when we start care with patients, we like to tell them it's a dose response. So similar to if you go and do any other type of body work, chiropractic or physical therapy or massage, you may see some relief that first visit, but every session is going to build on itself. So akin this to taking medications. So for most medications, you don't just take a medication one time and it's one and done and you're all healed. A lot of times you have to take a dose over a certain period of time. So that body response is similar in acupuncture, and that every session is going to have a cumulative effect, and depending on what we're working on, it's all going to build up to get you the results that you are looking for. So when we think about pain specifically, and that's not all I treat, but it is one of the things that usually brings people in the door. They're looking for some sort of relief from something that has been bothering them, keeping them from being able to go out and garden, or keeping them from going out and playing with the grandkids, or keeping them from being able to sit at their desk and work for periods of time. Now, caveat here, you should be taking posture breaks at least once an hour when you're at work, but you get busy, things happen, etc. You shouldn't have to live in pain all day long. So one of the things we like to tell people is, yes, we do want you to see results within the first week or 2 of you getting acupuncture. And a lot of times I see people at least twice a week for the first couple of weeks to really know that what we're doing is making a difference and that it is building on itself. But I don't like to drag people on. If we're not getting results in the first couple of weeks, we know we need to switch gears and we need to find something else to do. Now, if you're getting acupuncture for something like weight loss, or digestive issues, things like that, that response is obviously not going to be immediate, because it's not a magic button that we're pressing and all of a sudden everything inside of you is healed. So in my practice with acupuncture, I do couple a lot of my sessions with nutritional counseling, just because how we feed our body is very, very important, and how we make up our chemistry. You are what you eat, right? How we make up our chemistry is going to impact how our organs function. And we know from ancient Chinese medicine that these meridians, where we're placing the needles in the body, are related back to organ systems, let alone the soft tissue that's located just underneath the skin, which we are inserting needles to. So if you ever have any questions about how acupuncture works and what conditions it works for, most of the time we see a lot of musculoskeletal issues. That's aches and pains. People come in with injuries, because we are a chiropractic office, and Dr. Miller sees a lot of sports injuries, and we co-manage a lot of patients. So we'll do soft tissue work and adjustments with a patient. I'll see them over here on the acupuncture side for a little bit of needling, and doing both of those together really amplifies results. So I hope everybody has had a good week, and we will talk to you later with more of our acupuncture frequently asked questions.